hello again and very warm welcome to you. My name is Ulrike Seiler and I'm the CEO of neoplas of the company. And actually I will first to introduce a little bit the company and will hand over then to our expert with the plasma jet technology, Dr. Alberto Cordero. He's also joining and he has gained over 4 years of experience with the plasma jet and will share also his experience of this. So now neoplas as a company, we are a medtech company in the field of cold plasma technology, which is a revolutionary therapy to accelerate wound healing up to 50%. And our heritage is the human medical plasma jet technology, which is the world's best evidence-based plasma device in terms of safety, efficacy, and also the economical benefit. So we are based in Germany, in the north part, so close to the Baltic Sea. And it's a small city, it's called Greifswald. And we are also a spin-off of the Leibniz Research Institute, which is one of the best and well-known institutes to develop plasma sources. And we are also part of this kind of plasma cluster here in Greifswald, which is very, very unique. So, thanks a lot for your interest to learn more about the plasma technology and also for joining this webinar today, Jet Cold Plasma Technology in Veterinary Care. And I would also like to welcome and introduce Christelle Sarcone. She is the global lead for product development of our key strategic partner, Nitera. She is normally based in California and today also here in Greifswald. And I also would like to welcome what I mentioned before, Dr. Alberto Cordero. He is part also of our advisory board. He is a dermatologist and director of the VETDERM clinic in Mexico. He's a MVZ diplomate in Latin America of the Latin American College of Veterinary Dermatology. So before now moving forward, I always say pictures say more than 1,000 words. I would like to share with you a patient, pet parent story, a physician story with you to bring the acceleration of wound healing, what I mentioned before, where we are proud of, which bring it nicely alive. So I would like to ask you, Christelle, just that we start with that small movie.
My name is Dr. Christoph Klinger. I'm a double-boarded dermatologist and allergist at the Veterinary Specialist Clinic, Stuttgart Kliniken. Cold plasma therapy is a revolutionary intervention because it physically eradicates bacteria and other pathogens, whether they are resistant or non-resistant germs, while also being able to significantly accelerate wound healing capabilities. Kiro is a 6-year-old little pug that was presented to us for laser follicle cauterization due to bilateral refractory interdigital podopharynculosis. When a paw is treated with the laser, we are left with high-grade burns that require adequate medical care. Since we could only treat one paw at a time, Kiro gave us the advantage that the dog served as its own control group. The year before, one paw was treated without plasma, while the second paw was treated with the plasma jet kINPen vet, and we had a 50% shorter wound healing duration. Since I've been working with cold plasma for 8 years, our expectations were already pretty high. We were already expecting, or at least hoping, that the wound treatment time might be significantly reduced and that we would see fewer secondary infections. However, reaching a 50% reduction in wound healing time from 69 days down to 35 days exceeded even our expectations. And observations like that are the reason we are using the plasma jet kINPen vet at our clinic on a daily basis.
Okay, so referring to that very, I think, impressive video and story, our vision is here to empower medical performance to enrich lives, and is everywhere and every time. So what do we mean with that? We make the high precision cold plasma technology, we want to make it accessible for everyone. We also make it let's say, easy as possible to apply for every health professional. And third, we really aim to make that as a standard operating procedure. And we also enable the treatment really on the highest quality. So, Crystal, could you just move to the next slide? That's why we aim, and our ambition is to improve physicians or the experience and the perspective. As a second, we want to improve the pet care, patient quality of life. We also want to have a better outcome for the planet and also increase, particularly also for physicians, the revenue and the profit. So for that, we also put together the advisory board, which Alberto is also part of it. But there is also Dr. Christoph Klinger, you might know, from the vet clinic, the Anicura clinic in Stuttgart in Germany. Also Dr. Claudia Busse, she's working in the ophthalmology at the TIH in Hanover. And Dr. Ramon Almela, he is working there at the Tufts University. All have lots of experience with the plasma jet. And now I would like to hand over to Alberto, who will share with you his experience so far. He's working with the device since 4 years. He has plenty of amazing, great cases. And very warm welcome to you, Alberto.
Hello, everyone, and thank you, Ulrich, and thank you for being here. It's with great pleasure that I have been working with the company as an advisory board. Well, a little of myself. You can hear me, right? Okay.
Yep.
I have been working with the device for a little more than 2 years. I started to working with it in 2020 during the pandemic. And this was under the influence of my good friend, Ramon Almela. That was the one who induced me to know this technology. And I'm always looking for different things to improve my practice and to help my patients. And I think wound management, it's like a difficult concept to establish in a specialty. In humans, there is no like a specialty in wounds. So normally surgeons, general practitioners, internal medicine, dermatologists are the one dealing with wounds. In dermatology, we often deal with difficult wound healing in our patients, with infections, and we really know that in this age of bacterial resistance, we always are looking for different things that help us to reduce these problems. So that's one of our main issues. So I'm going to share something about the clinical practice that we have been using this equipment, how it works in a more general concept. And I think the advantage of using it and the opening for new research, it's amazing. Everything is like new. We are working right now in different protocols and trying to get together different cases and case reports to show the world the advantage of this new technology. So I think, Ulrich, you have our presentation, if we can probably start with that one. Well, the first thing I want to state is that once we start talking about plasma, cold atmospheric plasma, plasma is like really a related work of blood, and it's not blood. So sometimes when I'm talking about the therapy with cold plasma, everybody starts thinking about platelet-rich plasma, or different techniques that are used right now in order to help wound healing or decrease infections, or the one that ophthalmologists are using to apply directly to the eye. So plasma is not referred to blood, it's referred to the fourth state of matter. That this is what we are talking about. The plasma matter exists in nature, like in lightings, in the aurora borealis. Is there? Is a TVs. If we go to the stadium, all these lights in the stadium have plasma inside. So plasma is there, is the fourth state of matter. And what this equipment is doing is using the plasma state of matter to help and increase the level of something we call the reactive oxygen and nitrogen species. That is the main thing of how it's working. So when we talk about plasma, we talk about this and not about blood. Okay, so this state of matter is created electrically conductive. In this case, the kINPen bed is using argon. The argon we are using is not the same argon that is used on welding. It's a different one, more pure. There are of the visible matter in the universe is plasma. So it's just to understand how it's working. Can we have the next slide? Okay. So how this is happening? So the cold plasma, it's creating a highly effective antiseptic surrounding this jet that we are using. How is this working? With reactive oxygen and nitrogen species that we call RONS and ROS. If we want to study a little more deeply into how it's working, we need to understand the redox, the reduction oxidation process, and the oxidative stress that is created in some of the biological processes. So around this jet that you are seeing there, around this plasma jet, a lot of reactive oxygen and nitrogen species are being created, and this is causing change of electron ions. Some of the reactive oxygen species and nitrogen species that are creating, if I mention this to you, you will know about this because we use it. For example, ozone. Ozone is well properties, it's wound management. We have colleagues now that has been working with hyperbaric chambers using a lot of O2 oxygen there. So we are also putting oxygen, and it's another of the reactive oxygen species. We are using nitric oxide as well. It's being created around, and nitric oxide is well known that increase the cell production to double or triple the time. So all these processes is helping to decrease the amount of microorganisms, increasing the cell proliferation, but also has a direct effect on the redox process. So all the oxidative stress that has been created by some conditions are being contrasted with the redox process that is being created with the equipment. Okay, next one, please. Okay, this is the table that we put the reactive oxygen species and the reactive nitrogen species. All of these are being created around the jet. So around 1 centimeter from the jet that we are creating with equipment, we have O2, we have hydrogen peroxide. That when we are hearing this, we remember that we have products that has this, and they are used for wounds, for cleaning wounds. We have O2, we have ozone, radical organics, and in the side of the reactive nitrogen species, we have nitric oxide, nitrogen dioxide, and peroxynitrate. So this is being created around the plasma jet in order to induce the biological effects we will will witness with the clinical cases. Okay, next one, please. Okay, so we have two different treatments with the cold atmospheric plasma. We have a low intensity treatments, the short time, and you will see in some of the videos that I just placing the jet around the wound in a very short process, like trying to draw around it. And there is a high intensity treatment that takes longer time. And there are some studies in humans and in vitro studies that have been shown that high intensity treatments will help to induce apoptosis. And cancer research is being conducted with this equipment as well. So I think in veterinary medicine, in all medicine, just to get an idea, this equipment and the plasma medicine, it's 10 years old. It's pretty new. And in veterinary medicine, it's newer. We have a few studies in the VETDERM journal that I helped to grade and to review, and they are stating the tolerability and in vitro effect of antimicrobial properties. But the thing is, we are just beginning to understand how high intensity treatment will help us in some in creating apoptosis in some of in cancer treatment. So it's just food for thought to trying to understand how this could evolve during the years. Right now, we have very well experience in low intensity treatments that is create cell stimulation and antiseptic properties. Okay, next one, please. And this is one of the examples that we have used. This is an example from my colleague, Chris Klinger. We have examples like this one, this dragging wound of a dog that was run over by a car. And what I can tell you, when I started, this is taking off the shirt of working with the neoplas. When I started to work with this treatment, I was amazed of the recovery time. We are able to close wounds like this one in about less than a month, about 28 days. We can have a really good wound closure. And the best part is that we are not using antibiotics, and we are not getting this bad like stiffness that you get sometimes with the second healing process, that normally when you have these kind of wounds and you apply dressings and stuff, normally you get like this stiffening, and it's allowing not to have the movement you should. What I can tell you with the little experience I can tell you I have with this is that you don't have that. Patients can move the arm and move the leg with this stiffness, and you can see that in 35 days, we have a very good closure of the wounds. And you will witness other examples. Human one is the same. The only thing is doesn't say bed, but it's pretty much the same equipment. It's really easy to use. It has just two buttons, one for getting the power on, and another one to allow us to pass the gas or the jet, and a regulator knob that will help you to state how much of the gas you want to let pass in order to create that jet. So it's just that. You can even train your technicians to apply the treatments. So the training process is quite easy, easier than many other devices on the market. Okay, so it's a non-contact application. Once you start working with this, you will see a small jet, and you will hear like a gas coming out of this, creating this jet. And if you touch this flame, this jet, it's not a problem either. What you will feel, and because I have used it in myself a couple of times, you know, as a veterinarian, we have accidents. I was beaten by a pit bull a year ago, and it was a very bad wound, and I used the plastic use it myself. I don't recommend you to have a lot of chances with this. Try to avoid accidents. But the thing is, what you will feel if you touch the flame, you will feel like electric tickles. It's pretty much tolerable. And the thing is, when you are applying to the patients, you don't need to contact directly with the jet, because 1 centimeters around the jet, you will be having access to these reactive oxygen and nitrogen species. You can use it at any age, any size, any species. We have other clinical cases in reptiles, in birds, in horses, in humans, of course, and in dogs and cats. The precision technology is allowing you to apply it directly, because you are seeing the jet, and it's quite easy to apply. It doesn't. Once you do it 2 or 3 times, you will be on. Okay. We know, and there are studies about this, that it has anti-inflammatory and antimicrobial effects, included with MRSA, MRSP. It stimulates microcirculation to heal the wound and promote wound healing. Some of the things that you will witness in the clinical cases I will show you, because I can tell you many things and show you some best evidence publication, but I think what speaks for itself is to see the clinical cases and work with it. Next slide, please. Okay, so this is a jet, and you see that there are some around the jet, at 1 centimeter around. You see this ionized gas and the reactive oxygen species working. There is an attachment that we use that it's like helps to separate the skin. It's like blocked. It's a plastic one, and it helps you not to apply directly to the wound, right? It's a spacer thing that you can use, but you can use it as well like that. Okay. Okay, so this is some of the processes that have been tested in vitro. The TGF-beta, it's being upregulated, and this is directly linked to the wound healing promotion. Okay, next one. Okay, so this is some of the phases we have when the re-epithelialization process. We start with the exudation phase. That is the first days we have inflammation, so the first 3 to 7 days. Then we have the proliferation phase, the granulation effect. And when we are seeing this, and you will witness in the cases, you will see the granulation tissue that is more tissue there, and the proliferation phase. That is really interesting, because what I have witnessed with the equipment is that the skin seems to be getting together down to the center, like trying to fix and close the wound. It's not just creating a second intention healing. It's practically get together. Okay, let's see. Okay, so the 4 pillars of efficacy of this device are based in the sterilization and the contamination of the area, biotic and abiotic surfaces. Another thing that is important, these devices in the beginning, years ago, were used in industry. So you can practically apply it to something and it will become sterile.
I think I'm losing Dr. Cordero. I think you're breaking up. Let's see. Are others having a hard time?
Now I can hear, right? Okay.
Okay.
The third one is the angiogenesis with tissue oxygenation and in superficial and deeper layers. Remember that reactive oxygen species will help to this part, to the third one. And the fourth one is the promotion of growth factors, including the control of cell migration. Okay. let's
A quick interruption, Dr. Cordero. We have about 23 minutes, so we might only be able to spend half a minute to a minute per slide going forward.
Okay, yeah, let's go directly to get the clinical cases that I think. Let's understand the protocol. The protocol is really simple. Twice a week, right, for 2 to 4 weeks. Sometimes we use it once weekly, depending on the availability of the owner. 30 seconds per centimeter square of wound area. Normally, if you see the literature, we will say that 1 to 2 millimeters per second. So it's pretty much that using circular movements. The jet to the wound distance of 1 centimeter around. You will see, you are seeing the slide that there is a plastic thing that's providing the separation of that. And it's pain-free because you are just putting the air. However, if you place the jet directly to the wound, the patient we may feel a little discomfort. But we have been witnessing the discomfort only in like in normal skin or intact skin. When we have these huge wound areas, normally we don't have that problem, but it's pretty much pain-free, okay? So let's continue with this one. Okay, let's see the cases because that's the interesting part, okay? This is one case of my colleague, Chris Kringle. It's a deep auricular ulceration due to vasculitis, and you see that it's a Labrador cross, 4-year-old. It has been on treatment against leishmaniasis for 6 months, and it developed a deep auricular ulceration. You can see the cartilage there, and even with several medications, they were not being able to close that one. So they start with the treatment twice a week for 4 weeks, and we can see the improvement at day 28. It's pretty much closed, okay? And this is the average time we have been witnessing. This is one that I have, the next one. It's this acrylic granuloma. This was a Great Dane with a joint problem, and he developed this one. It was under Elizabethan color. It was with NSAIDs, even with that. And the only thing I did is I continued with the Elizabethan color. I continued with the NSAIDs, but I applied twice a week treatment. I just cleaned the wound with some disinfective agent, and then apply the treatment, and we can see the improvement at day 14, and at day 28 is pretty much closed. Okay, let's see another case. This is a really interesting one because it changed what we have been dealing with the times. This is a patient that was on doxorubicin. I don't remember the exact motive, but the thing is the doxorubicin was infiltrated into the tissue and it created necrosis. In this case, it took a little more time, and normally we combine a little with some dressing. So we combine advanced wound management with the use of this treatment. I have to state that this dog was before on some kind of wound management, and they were about to amputate the wound. And we can see the dates, May 22, May 22nd. This is from this year, June 3rd, June 12th. So it's around 20 days. In the next slides, we can see the improvement. This is June 30, July 21st, and this is just last week, okay? It took longer, but I think it's due to the cytotoxic effects of the chemotherapeutic agent. This is the only case we have of a chemotherapeutic agent effect on the wound. It took longer, but it's getting there. And I think we will be able to save that limb. Okay, next one. Okay, this is a post-surgical podoplasty dehiscence. It's one of these bulldogs. We have to do the podoplasty, and it didn't heal as expected after the surgery. And we are seeing the dates. It's April 10, April 13. Actually, it's written there. It's in Spanish, but you can see that it's written there. And April 17. So it just in 7 days, we have an improvement. And in the next slides, we will have the next ones. Look at that, May 13, 20-something days, it's pretty much closed. Okay. Another post-surgical dehiscence, this was one bite that they just close up. And of course, some of the bite wounds get complicated. It was prepared on August 8. Then a few days after, it's opened up. And in the next slide, we can see that we debride the wound, we cleaned it up. This was on August 18, and this picture is like from the day before yesterday. And you can see that it's pretty much closed in 10 days. So it's really impressive what we can achieve with this technology. Okay, vasculitis patient. Also, we have been using it, of course, in combination with some of the treatments. And what we have witnessed is what we get a nice acceleration of the process. August 18, we have that nice tail affected with vasculitis. August the 22nd, I'm sorry, and August 26th, you see that the inflammatory process and the ulcers are really decreased. Okay, another surgical wound dehiscence, a boxer that was going under after a muscle tumor excision. It went open. We see day 0, day 7, and day 14. 14 days, and we get a nice one. The protocol is the same that we've been using. Okay. This perianal fistula is from my colleague, Chris Kringle. Actually, I think he presented something like that in the past NAVDF. And what he did is he placed a paper in the middle of the wound, and he just treat one side of the wound in order to see that it's been working. It was on the different treatment, and we can see that the treated side it's slightly better than the other one. Okay. This is a resistant MRSA in a joint infection. It went on the different antimicrobial therapy as well. He's from my colleague Chris Kringle. And you can see the nice improvement of the wound just with 15 days. So it's and it's pretty good because it's a small kitten, so sometimes you don't want to use a lot of systemic therapy, and this is a good choice. Next one. Okay, this is another one. This is a wound dehiscence post-mastectomy, and you can see that the wound is pretty open at day 0. It's a Bisla, 5-year-old. It was under a mastectomy to remove some neoplasia. And we get into some healing problems. 7 days after and 21 days after. And these are some of the things I have been telling you about and how the skin seems to be attaching and getting together to down the center of the lesion. And as you see, there is not a lot of secondary healing tissue around it. It seems to be like the skin is like wrapping itself around the wound and closing it up. Next one. Okay, this is a cat, and you can see that it's a bad cat because the wound is on the face, and we perform these therapies under no anesthetic process. We just grab the cat and try to control it and apply directly the jet to the wound with no other anesthesia. And this at day 7 and at day 21. There were no application of any antimicrobial therapy, systemic therapy as well. So you just did the first wound cleaning, and we continue with twice a week the application of the therapy. Okay. In exotic animals, this is an atypical infection on the ball python. It was multi-resistant with the Streptococcus maltophilia. This is a case of Chris as well. This is on day 0. And you can see the affected tissue. And can we put the other? Okay, that's the application, and you can see how the lesion is healing. Okay, next one. Calcinosis cutis due to steroid therapy. There is a deep inflammation at neck cell destruction. I have a couple of cases that I have tried with calcinosis cutis as well. At day 24, you can see this great improvement, and these calcium deposits are starting to decrease. Of course, it will be helpful more to decrease inflammation. This is at day 38. We have a nice improvement as well. Okay. This is one of my cases as well. This is a severe autohematoma with cartilage exposure. They were managing surgically the hematoma, the auricular hematoma, and something was complicated. And it was referred to us with this exposure of cartilage. I didn't do anything. He was on their different dressings and stuff. What I just did is apply twice weekly the process and clean the wound every time I was receiving it for the application of cold plasma. And that's it. And you can see that in 14 days, we have a nice cleaning. This was closed after 21, 25 days. This is the first case I show you with the drug wound. You can see how the process was achieved. They place some sutures in order to attach the remaining tissue. And next, the only thing they do is just apply the therapy, okay? This is one good example of one. This is how it's applied, just the air is not touching with the jet. You just see the air going around. So this is very helpful because the patient is pain-free. You don't need to apply anything. You need to apply a little restriction if it's in the face because sometimes they move or they feel the air or they feel the discomfort, but it's not directly related to the application of plasma. The cold atmospheric plasma is around 40 degrees Celsius, so it's not really heat. It's quite tolerable. And that's it. That's the only thing we need to do. It's like drawing the wound and that's it. Okay, this is another one with major skin loss, plastic reconstruction in a cat. It's a severe case of post-surgical necrosis. So they debrided surgically all the dead tissue and then apply the plasma kINPen bed. And you see 8 days after that. And we can have these next pictures. Okay, that's day 31. And you can witness the size of the wound. So it's pretty much 1/3 of the total body area. Okay, and at 46 days, we're seeing that improvement. At day 60, it's pretty much closed. Okay. Next one. This is, for me, our best case because it has a nice story. It's a small kitten that was run over and thrown away next to the road. And some good soul stopped and picked it up. It was a kitten of 1.5 months of age. And this is how we receive it. And once we clean the wound and everything, you can see how bad the extension of the wound is pretty much half of the body. Can you put the next one, please? The next slide. Okay. Okay, look at that. Once we start clipping all the bad hair, that is what we are looking at. Okay, we clean the wound. We apply some initial dressing for the wound and remove all the dead tissue and start applying it from the beginning, the cold atmospheric plasma. Next one. Okay. So that's what we did. They put a huge dressing all the side of the cat and place some sutures to stitch the remaining tissue. This is on this is on October 5th of last year. Next one. And this is on October 11. And that's how we are applying the tissue. Unfortunately, we have to amputate the limb because it was just hanging from a thread, and she lost the left limb, front limb, and we're applying the cold plasma therapy. The first one we applied as we are using anesthesia for the management. That's the only time we use anesthesia on this patient. Okay, next one. Okay, you see, we're touching a little with the ray. It's not a problem. It's under anesthesia, but you don't need to touch directly with the plasma jet. Okay, next one. Okay, next slide, please. Okay, that's October 14. That is like 3 days after that, and we are applying it. And let me tell you something. If you are familiarized with the wound management, you will know that the groin part is one of the hardest part to close because all the stretching area and the movement. Next one. And this couple of weeks after that. In total, we spent 28 days closing that wound. Okay, next slide. Okay, it's wake up is not under no anesthesia. You can see how small was the patient. Okay, next one. Okay, this is October 18, so it's just like a week after that. Next one. And you can see that it's pretty well tolerable. Next slide, please. Okay, this is October 21st, so we are pretty much having 70% of the wound closed. And this is October 24. So what I find impressive is how the skin starts to close and create like a wrapping around the wound. We're not having this ugly tissue. Okay, next one. So this is October 27, right? A few weeks after that. And you can see that I was worried about the healing process, especially because of the hair loss. But I will show you a picture. After a few months that we finished this is like the time we ended up. It's November 3rd, and it's pretty much closed. And in the next slide, I think I have a picture a few months after that. You can see how great the recovery is. And I think I have another picture of a few months after. She's all grown up now, and you can see how good this recovery is. She's really happy in the new home. The owners love her. So it's one of nice cases. Okay. Next one. Okay, in summary, just to grab all the information, we can use this in patients of any age, any species, in severe ulcerative and deep wounds, in multi-resistant infections such as MRSA, MRSP, atypical infections. There are some cases, I know my colleague Chris Kingle have used it in some mycobacteria with good success. Wound healing disorder, even with vasculopathy, that we show some cases of vasculitis, and cases with severe traumatic tissue loss. So I think we cover some of these over there. Acute necrotizing disorders, practically in any difficult wound. And the areas of practice are there. We have a general practice as well next to the dermatology consultation. And we have ophthalmology, we have dentistry, and we have surgery. And what I can tell you is the surgeons, the orthopedic surgeons, are putting together some clinical cases when they have been performed orthopedic surgery, and they have been closing plane by plane and using this during surgery on every plane and closing the wound and not using antibiotics after that. And this is crazy because it changed everything you know about orthopedic surgery. I know some of you may not be orthopedic surgeons, but if you talk about this and say, I'm not using antibiotics in this orthopedic surgery, they will call you crazy. And they are choosing some cases, of course, with owner consent or dogs that have been rescued. And they have like 3 or 4 cases now that they haven't used any antibiotic after the surgery. Okay. Okay, so I think the clients they like that it's pain-free. They like that it's easy to use. You can train pretty much anyone in the staff to do it, your technicians or any of the vets in your staff. And if you work or own a large hospital, I'm pretty sure you have several areas that you can apply it there. Okay, so I'm ready to try to respond to some of your questions, hopefully.
Thank you, Dr. Cordero. We can open it up for questions. I know we have a few more minutes until the top of the hour, and happy to stay on a little bit extra if folks have stimulating inquiries. So.
Well, I have a question.
Hi, Stephen.
Hi. Nice presentation. So in your opinion, the healing that happens, I mean, it was very impressive, especially in that cat, that the hair grew back. So is it your impression that the healing that does occur is as strong or as able to withstand stress of the motion of the animal as it would if it was naturally healing, i.e. without this? In other words, are there instances where everything heals up and then the animal runs across the street or catches a ball or something and things split open again?
Yeah, no, I think it is. I think part of it is because there is not the same stiffness that you witness with the regular healing process. And several of the patients we have been used, we are not restricting it as much. This young cat was really, it was an active cat. She was happy and getting around, and we didn't have that problem. Another thing that I believe is that the progressive healing and this like cascade of cells that are trying to get together is part of what is creating the strength of the healing. But now we haven't witnessed that it just open up. Once it start to heal, once we see this red bright tissue, we call it that we are crossing the bridge and everything will be continue evolving positively.
Thank you.
I mean, if there are no further questions, I mean, you have also still the opportunity to send us an email and hello@neoplas-vet.info. So to keep also here in touch.
We're putting together some interesting things to present in the World Congress in Boston next year. All the dermatology community, we are very excited of this next World Dermatology Congress. So if you are not receiving all the updates, just get into the social media and get the latest updates. It will be 25 to 29 of July next year in Boston, Massachusetts. So if you practice dermatology and you love dermatology, you have to be there. It's like our Olympics every 4 years only. So, and I think we're a friendly group. So you should join and witness the latest advances in the specialty.
Thank you very much, Alberto. If there are no further questions, comments, then I think we can close the session. Thanks a lot to everyone for joining, taking the time. I hope this was a good lecture for you, that you learned also more about the cold plasma therapy with our plasma jet. And hope also it was inspirational. And yeah, maybe you want to connect with us, and also that you maybe like to try the device, to run a pilot. We are very open for collaborations, so that we can also transfer our experiences here in Europe and particularly in Germany, to US or to any other market. Thanks for joining. And
thank you.
Have a great day wherever you are based, or evening.
Thank you.
And let's stay connected.